All right, well, good morning, everyone. Thank you again for joining the May Connect OC Coalition meeting. We'll go ahead and get started. Once again, for anybody who's just joining, I want to invite you all to introduce yourself in the chat. Happy Mental Health Awareness Month. So our topic this month, well, a couple things. One, so we are the Connect OC Coalition. We're a program of Partners for Wellness. We're funded by the Orange County Healthcare Agency, Office of Suicide Prevention, through the Mental Health Services Act, Prop 63. We're a community coalition focused on expanding knowledge and promoting existing resources for 16 to 24-year-olds today, transitional age youth, and young adults here in Orange County around mental health and mental wellness. So that is our focus as a coalition. And in line with that, especially since it's Mental Health Awareness Month, we wanted to cover a topic that I hadn't really heard covered too much elsewhere. Actually, it was part of a conversation that I had with one of my fellow staff members here at Partners for Wellness, Alexandra Paulsen, who will be on the panel this morning. And it was really around the use of health insurance to access mental health services. I think in some ways this topic seems so mundane that it almost seems odd to cover it, but particularly for this age range, 16 to 24-year-olds, there's a number of opportunities for them to utilize health insurance plans available to them to access mental health services, although it's not always clear cut about how that works. And there's certainly a knowledge gap about, again, what does that look like? How does that work? What services are available to me? How do I go about accessing those services? If I don't have health insurance, how do I get signed up? What's the best option for me, given my circumstances or context? So we're going to cover a number of those things today, in hopes that it will aid us better supporting youth and young adults in this transitional period in their lives as they seek to access mental health services. So I'm excited about our panel. I think it's a good group, and I will just introduce them all by name and then give them the opportunity to introduce themselves a little bit further. And we'll start off with the home team. Alexandra, why don't you introduce yourself?
Thank you. My name is Alexandra. I'm the Youth Mental Health Project Director at Partners for Wellness. And I went to UCI in my undergraduate career, and that's how I was familiar with accessing services there. Granted, I am a few years out, so things may have changed, but I'm really excited to talk about my own experiences.
Yeah, Alexandra, I think would be an interesting voice because she's in the field now, but she's also someone who has a student had a personal experience around the issue we're talking about today. So I'm looking forward to sharing her experience with you all. And then Kailey, if you wouldn't mind introducing yourself.
Yes, I'm Kailey. I'm the senior front office team lead for Mindpath College Health Irvine.
Hey, thanks for joining. And Portialyn, if you wouldn't mind introducing yourself.
Yeah, good morning, everyone. So happy to be here. My name is Portialyn Buzzanga, and I am the Senior Director of Operations for Mindpath College Health. And then I am the local Mindpath College Health Irvine Clinic Director. So work very closely with Kailey.
Thank you for joining. And last but certainly not least, Shelly, if you wouldn't mind introducing yourself.
Sure thing. Thanks for inviting us, David. Good morning, everybody. My name is Shelly Lozada, Senior Community Relations Specialist at CalOptima Health, and I look forward to just chatting with the other panelists today and sharing some information about CalOptima Health.
Great. Excuse me. Great. Well, I think we want to start off with taking the opportunity to have you all introduce a little bit about the work the organization you're representing does, and the work you do with them. And so, Shelly, I'll start with you, if you don't mind. So what is the work of CalOptima? And then maybe we'll follow up from there with a little bit of a rundown about what is, how does Medi-Cal work? Who is CalOptima as the Orange County Medi-Cal provider, and what services you offer, and kind of how this all connects to our bigger topic of youth and adult mental health.
Sure, I'd be happy to start. And, David, you actually already said a couple things that I'm like, you're very knowledgeable about CalOptima Health and Medi-Cal, but I want to take it a step back because sometimes people don't realize that Medi-Cal is the same thing as Medicaid. And so I always like to point that out, because when we listen to a podcast or we're watching the news, the word that we hear that is used is the word Medicaid. In California, we changed the word up and we use like this play on words. So instead of Medicaid, we use Medi-Cal. So I want everybody to just jot that down. When you hear Medi-Cal, know that it's the equivalent to Medicaid. And again, I like to point that out because some people don't know and other people confuse it with Medicare, which is completely different. So in the beginning, David mentioned that some people might know it's sort of a mundane topic, but on top of it all, it's also super complicated. So I'm really grateful for this opportunity to chat and explain about what it is that we do, what is Medi-Cal, how does it all work. So again, from the top, Medicaid, Medi-Cal equivalents, and every county operates a little bit different. So in Orange County, CalOptima Health is a community health plan for low-income families, seniors, and people with disabilities. So again, in Orange County, CalOptima Health manages the Medi-Cal benefits. I point that out because sometimes people will say, hey, well, yeah, I have a client that is from LA, so they have CalOptima Health, right? And I'm like, well, they have Medi-Cal, if they have Medi-Cal, but not CalOptima Health. So it gets a little bit complicated. But for all of us here, I think we all work and we are all service providers in Orange County. If somebody comes to you and tells you that they have Medi-Cal, then they're part of CalOptima Health. And so if there's any questions, concerns, anything, it's a CalOptima Health question that would come to us. So how does somebody apply? How does one gain services? Well, it's a lengthy process. As I mentioned, every county operates a little bit different, but every county, there's social services agency, and social services agency are the ones that determine eligibility. So they're the ones that receive the Medi-Cal applications, they review them, they process them. And at the end of the day, they're the ones that will give it the stamp of approval, or they'll say, sorry, you don't qualify. So if somebody is eligible for Medi-Cal, Social Services Agency here in Orange County will let us, CalOptima Health, know that we now have a new member. That member is also notified and they're told, hey, you qualified for Medi-Cal, and CalOptima Health will manage your benefits. So that's how it works in a nutshell, but I will say it's a lot more complicated than that. It's also a very lengthy process. From the very start, it takes approximately 60 days for Social Services Agency to process the applications. After that, it can take another month and a half for everything to kind of get settled. At that point, CalOptima Health is notified, and then we give the individual another month to select their doctor, the health network. And then on top of it all, people have to renew their Medi-Cal every year. So every year they have to renew. Typically what happens is an individual with Medi-Cal will get their packet in the mail, and it'll say something like, hey, it's time to renew. Has anything changed? Has your family grown? Has your income changed? So they ask a series of questions. And again, the packet comes in the mail. So people have to just answer the questions, send that back, and that way their Medi-Cal gets renewed and there's no interruption in services. Sometimes people forget to renew. And so what happens is, let's say they didn't check the mail. I know I'm guilty of this. I hardly ever check my mail. I check my email, but not my actual mailbox. So people miss, whatever comes in the mail. They might miss that packet and so they might not renew. And then let's say they try and go get therapy services, or they try and go to the doctor. At that point, that doctor or that service provider might say, hey, you no longer have Medi-Cal. We can't see you. And so it's super important for people to remember to renew if they have Medi-Cal. And again, it's on a yearly basis. So if somebody applied today, May 26th, in a year, they would have to renew. So every year. We serve 1 in 4 adults and 1 in 3 children, which is just mind-boggling to me, because when you think about it, that's a lot of people. We actually have close to 1 million members here in Orange County. And most people think, wow, it's Orange County, there's so much wealth and there's so much money going throughout the county. But when you look at our data and our statistics, we have close to 1 million members, which means that there's a lot of people that are falling under the low income bracket. And so again, for all of you to know, Medi-Cal or CalOptima Health is Orange County's community health plan for low income families and individuals. So hopefully that answers everybody's question about what it is that we do, how we operate. David, do you have any follow-up questions?
Yeah, I think that was a really fantastic rundown. I feel like I've got a good grasp of the basics. I'm wondering for our audience, if I'm working with a young adult who is seeking health insurance, I guess kind of a two-part question. One, how can I best support them in that process if they're trying to explore whether or not they might qualify for Medi-Cal, or if they do and they're trying to get signed up? How can I best support them? If you have some thoughts about that. And then the second thing is there anyone that a young adult can call or talk to help move through the process or help make sure they're staying on track in the process?
Sure, those are really great follow-up questions. So in terms of applying, when I mentioned that Medi-Cal is for low-income individuals in Orange County, that means that the individual's income definitely is looked at. Sometimes I know for myself, my personal experience, when I was going through college, I was not working full-time, so I didn't have an income, or if I did, it was very little, but I was under my parents' insurance.
Right.
And so I had health insurance through them. That meant that they also filed their taxes and claimed me as a dependent.
Mhm.
So all of that kind of goes into consideration, because sometimes somebody who's 18, 19, 20 or so forth, they might be working full time and they might do their own taxes separate from anybody else.
Right.
And so at that point, they could process the application on their own. So it all kind of falls under that. So somebody that is maybe in college and is looking to apply for Medi-Cal, all of that would come into consideration. In terms of behavioral health or mental health services, if somebody with Medi-Cal, let's say they already have CalOptima Health, they're one of our members, and they're interested in receiving behavioral health services, they could call in to our behavioral health department and self-referral. What happens at that point, we actually have a behavioral health department. So we actually have a direct number to that department separate from the CalOptima Health main line. So an individual could call that behavioral health line and say, hey, you know what, I'm interested in seeing a therapist. How can I go about it? Does Medi-Cal cover it? And the answer is yes. So behavioral health services are covered under Medi-Cal. It is a CalOptima Health benefit. So when that individual calls the behavioral health department, a customer service representative answers the phone and they do an over-the-phone assessment. They ask a series of questions and they try to figure out, that individual, that customer service rep tries to figure out what services that person might need, whether it's mild to moderate, is it more severe? They have that over the phone assessment that they process. If it's mild to moderate, the customer service representative will give the member a list of resources and they'll say, hey, here's who we contract with and these providers are available, and you can call and then schedule your appointment so you can start receiving the behavioral health services. So it's totally self-referral. Sometimes people think that their primary care provider has to make that referral, and the answer is no. Actually, anybody could call into that behavioral health department, self-referral, and go from there. So that's how somebody would get linked with our behavioral health services.
Great. Thank you, Shelly. I think I appreciate that rundown. Maybe I'll take the opportunity to kind of talk to check in with Portialyn and Kailey and hear a little bit more about Mindpath. And then we'll come back around and we'll kind of dive a little bit further into the discussion from there. So Portialyn and Kailey, I don't know if you want to tag team it or if you want to say 1, 2, 3, not it, but what is the work of Mindpath? So it's kind of the first question. So what do you all do? Who are you? What services do you offer? And then I'm aware that you interface with UCI and their student health insurance plan. So what does that look like for you? And yeah, maybe you can explain a little bit about that, how that came to be for you all.
Yeah, absolutely. So I'll do an overview of Mindpath College Health, and then Kailey can talk about that insurance piece and working closely with the universities. So I think it's worthwhile to kind of start with Mindpath College Health is formerly known as Acacia Counseling and Wellness. So we had a name change a little over a year ago. So when we started as Acacia, it was in 2014, and we started near the campus of UCSB. So I just kind of mentioned that because as Mindpath College Health, we're a little bit newer, but we've been around for a very long time. We have the same office locations, the same team, the same leadership structure. We just kind of had an identity change. So we've been around since 2014, and we have 6 offices in California near some of the major UCs. So we represent the UCI. And then we have 1 random office in Minnesota that serves the University of Minneapolis. So all of our offices are almost on a UC campus. So if you're familiar with UCI, we are right across the street on Campus Drive in the UTC. So right above Target, kind of around from the Trader Joe's right there. And so with that, the premise in our locations is to make sure that we had accessibility for students who were in need of services. So we realize how it works with the universities. Students are able to pop into the counseling centers or to student health to request services. But unfortunately, with the population there at those universities, the staff there can't treat all of the students who are in need, especially for that longer term care. So that's where Mindpath College Health comes in. So students can access our services on their own, or they can go to that counseling center or student health and receive a referral to our clinic. So we offer long-term weekly therapy sessions. So majority of our clients, they see their therapist same time, same day each week. So if you have Mondays at 2 p.m. is yours until you graduate, you take a break for summer, your schedule changes, and then we find a new time for you, or we do a handoff to services in the community if you're graduating and your insurance changes or something like that. We also provide psychiatry services. So we have nurse practitioners and psychiatrists on our team. And it's not necessary that students access both services. We have some students that are seeing a therapist only. We have others that are seeing psychiatry only, or we have some that they see us for therapy, but they have an external med management provider, and that's okay too. Something new that we were so excited to get started this past spring was our first group. So we have a provider who I call him a group guru. He loves groups. So we were able to have our first group offering to students, which was really, really big because groups are a nice kind of introductory to some students who are newer to mental health. I think it helps with kind of normalizing what a lot of the students are dealing with and focusing on. But then also too, we know that the university also offers groups, but they have an overflow and a wait list. So we partner with them. They'll sometimes reach out and say, hey, if you're going to be offering any groups, could you please think about offering X? Or if you could offer, Y, that would be really great. So weekly therapy services, medication management, and groups. We do our services in person. And then because of the pandemic, we also had gone exclusively remote for a couple of years. And we're now doing a hybrid. So we have some students, all they know is telehealth because at the point in which they entered the university, that's how services were being done. We have other students who maybe they've been in treatment for a very long time and they very much benefit from doing that in-person work. So students have that option to kind of choose what works best for them. And then with our teams, same thing. So our teams do a blend of some in-person days and then some remote days as well. That was like the high level. I was talking really fast overview, so ask whatever questions.
No, that's great. Yeah, that's, I think, a solid overview. I think I've got a good grasp of the baseline of who you are and excuse me, the services you all offer. Thank you. And Kailey.
Yes. So yeah, I'll go over how kind of we work with insurance at our clinic. So as Portialyn mentioned, we work very closely with UCI, and we also specifically work really closely with the UCI UC SHIP office. So whenever clients have UC SHIP, as Portialyn was saying, they can get that referral from the counseling center or student health, or they can request it directly from the UC SHIP department as well, and they fax directly the UC SHIP referral directly to us. So it's a really seamless process. And if clients are having any issues getting that referral or any questions with UC SHIP, I also reach out to UC SHIP and kind of help get that process started for them with that. And the majority of our clients do have UC SHIP, and then we also sometimes our offices overlap, so we see other UC, non-UCI students as well from other UCs. So we also work on getting those referrals with them. But UC SHIP is definitely our #1 insurance that we do see. And then we do accept other insurances. Of course, this isn't inclusive because there's also some smaller plans that we can see that we're in network with. If students do provide that to us, but some of our biggest insurance providers that we do accept would be Anthem, Aetna, Optum, MHN, Cigna, and Magellan. So those are some of our biggest insurance that we do see from our clients. And in terms of helping our college students with insurance, because for a lot of them, this is their first time having to deal with insurance on their own. And, you know, there's a lot of verbiage and kind of complex terms that insurance uses. Before their first appointment, we verify that their insurance is in network. And if it's out of network, you know, kind of communicating that to them to make sure that they know what the cost is going to be. And additionally, before their first appointment, in their appointment confirmation email, we include an insurance guide. It's kind of like an FAQ, and it goes through all the insurance vocabulary, kind of how to speak to your insurance, kind of how to advocate for yourself, how to do a coordination of benefits update, and so on. And then the last thing we do to kind of help students with insurance is we also have a billing representative at our Mindpath Health, specifically for our vertical Mindpath College Health. So if clients have any questions on their balance, kind of how claims are processing and why they process that way, they can give our client-facing biller a call, and she can also help them navigate that process.
Great. Yeah, that's helpful. And I appreciate Portialyn your comments down below. This was new to me before we ended up doing this coalition meeting. Kind of one of the reasons why I thought of it is, or we decided to do it is, SHIP is the student health insurance plan, right? Available through UCs, and Portialyn, you mentioned it's an Anthem plan.
Yeah, it's a carve out of Anthem. And so most of the UCs all have UC SHIP. It might look a little bit different university to university. So for example, Berkeley, they have a different plan than the rest of the other UCs. But that is one of the reasons why Acacia, now Mindpath, set up where we did, because for most of the students who were opting into the insurance, it would be covered or have a very low copay. So for our students this year, it's a $0 copay. And I think that changed during the pandemic. When we first opened, let's see, August 2019, for about 2 years, it was a $10 copay. So it keeps it very low cost or no cost to the students, but most of them, it's all an Anthem plan for the 6 UCs that we work with.
Great. Yeah. And then, I mean, since we're on this topic of SHIP, the student health insurance plan, I think it's a great transition. First off, Portialyn and Kailey, thank you for the rundown of Mindpath and the work you all are doing. And then shift over to Alexandra and her friend who's visiting. who you also have to introduce, about your experience, Alexandra. So you, like I mentioned at the beginning, you have kind of unique perspective. You know, you're working in the mental health field now from a public health perspective, but you're also, when you were at UCI, you spent some time on the, and I'm not sure if this is the right term for it, forgive me, but the student advisory board for the student health insurance plans and access services yourself. And so maybe you could share a little bit about who you are, your work with Partners for Wellness, and then a bit about your experience at UCI.
Absolutely. Thank you. Also, I apologize for the loud noise right outside my window. They decided to do lawn work exactly the moment that you started talking to me. So this is just
As they
fantastic
do.
timing.
Yeah. that's
And
great.
I'm going to have maintenance coming at any minute now. So this is just a chaotic morning.
Oh, wonderful.
But thank you. So yes, I work in the mental health field, but from a public health perspective. So I work at Partners for Wellness, and I'm the youth mental health project director. I run a grant that is funded through the Department of Healthcare Services in California. And what it entails is providing mental health resources to youth in Orange County, primarily ages 12 to 13 to 18. So that middle school and high school range. And part of the resources that we offer, we offer connections to therapy services. We ourselves don't provide the therapy, but we connect them to other clinics that do and help with their insurance and what have you. And I've worked closely with the Student Health Insurance Advisory Committee at UCI. So for about 2 or 3 years, I served on the SHIAC board, which is a Student Health Insurance Advisory Committee. So I sat in on meetings with a few other student representatives and representatives from the actual insurance plan. And we would go over benefits and figure out how to best provide services to students, what we believe would be necessary, what avenues we'd want to go to deliver education to them. And one of the things that I always advocated for is trying to have at least as most coverage for mental health. I wanted to have, wanted to advocate for the students that needed low cost, no cost copay. And that was something that very thankfully the representatives were willing to hear. They received that very well. And I think that, I don't know how much you can hear that, but they are right outside my door.
Not at all.
Sorry, I got a little lost right there, but I think working with the advisory board for the insurance, I myself am somebody who uses insurance a lot. So I'm very already familiar with the way insurance works, but I am glad that I was able to serve on that board and advocate for students who needed insurance, because when we first started meeting, I remember one of the insurance representatives himself was saying, oh, young people, they don't really need insurance. They're not really going to use it. We could probably cut down the benefits. And there was me and a group of the other students were saying, I don't think that's a smart idea. So granted, I was also looking at it not just from a mental health point, but I was looking at all of the specialty services a student might need. But mental health was huge, especially given, and I don't know if this is the same at every UC campus, but at UCI, we do have the counseling center, which was mentioned. However, they only provide 10 sessions. And on your first intake, when they go over everything, one of the first questions they ask you is, do you already have insurance? And if you say yes, and they said, and it offers mental health, and you say yes, they'll basically say that there's nothing they can do. It's to keep the availability open for students that don't have access to insurance. So if you do openly admit that you have insurance or some other way, then they kind of gently defer you to your insurance provider. Also, the counseling center is really meant for that short-term type of therapy. Like you're going through a very stressful situation with your academic career and not necessarily needing anything super intense or long-term. So they really do kind of send you out on your way. And that's why it's really important for students, especially if they're on the insurance plan, to know what it is they can use and how to use it. Hopefully that answered it.
That was fantastic. Yeah, thank you. Yeah, I think that this topic really invites, and the question here is, how can we help? One thing I'm hearing consistently is that this can be a complicated process, right? Health insurance provides access to a lot of benefits that would be either cost prohibitive or not as widely available without access to an insurance plan. But at the same time, navigating an insurance plan can be kind of complicated, right? And so maybe a question I open up to all of you is how can those of us who are working with youth and young adults, supporting them, friends, family, faculty, other providers that are working with young adults, how can we support their access to health insurance, and once they've accessed health insurance, their access to mental health services through that? When I say how can we support, how can we help them navigate? Is there anything that you all can think of that would be an important tool or skill to utilize to help young adults better utilize their health insurance or access health insurance?
I'd like to start, David. As I mentioned, Medi-Cal is available for the community, right? So it's typically people that have Medi-Cal are low income or might have no income. So when somebody comes to a case manager, a social worker, they might disclose, hey, I'm not working, I don't have any income. That right there should be like, ding, ding, ding. Okay, this person might qualify for Medi-Cal. And so the Medi-Cal application is rather complicated and rather confusing. Luckily, there's different avenues and there's different organizations that assist with the application process. And so earlier I said, social services agency determines eligibility. So anybody that's interested in applying to Medi-Cal can go directly with the county social services agency. However, there is other options. There's the other organizations. I saw Erica is in this meeting, Erica Vargas. She works for CHIOC, Community Health Initiative of Orange County. And that organization also supports Medi-Cal applications. So CHIOC has enrollers and they work with the community. I believe that they have an office almost in every city here in Orange County. And sometimes they even go to events to help with the enrollment process. So there's organizations like that. There's also the Coalition of Orange County that help with the enrollment process. There is the FACS. Those are the resource centers that are sprinkled throughout the county, and they also can help with the application process. So there's different organizations that have enrollers to get people to apply for Medi-Cal. Because again, if somebody discloses that they don't have an income or that they're low income, that should right there tell you like this person might qualify for Medi-Cal. And then once that application is filled out, and if they're granted Medi-Cal, then they will have health insurance and they will be able to access mental health services through CalOptima Health, through Medi-Cal. And when somebody is able to get linked up with a therapist, that therapist will then decide when it's time to close off the sessions or when to really to my understanding, there is no limit or there's no number of sessions that they might have. It's up to them. They consider it isn't medically necessary to continue these sessions. So we have members at CalOptima Health that have been receiving mental health services for a really long time because it's still medically necessary. So that in itself, utilize, just going back to the first part of the question, access these different organizations that assist with the enrollment process for Medi-Cal. And then once that person does gain access to Medi-Cal, then go through our behavioral health department to get that individual linked up. The other thing that I want to mention is medication. So oftentimes when somebody is diagnosed with depression or, any diagnosis, they also might be prescribed medication. Medication is a Medi-Cal benefit. So that individual can now have access to a therapist, to their behavioral health services. And if they're prescribed medication, they can also go to the pharmacy and pick up their prescription And so that way they're being served as a whole.
Great, great. And I want to kind of quickly follow up with there's a follow-up question in the chat. And I from Jessica, I appreciate this question. She asked if there's a youth that has CalOptima, and this actually is true not just for CalOptima, but although you can only speak to CalOptima, Shelly, this applies to a number of health insurance questions, right? In general. So if there's a young adult, a youth or young adult, either under 18 or 18 plus, who wants to seek services without their parents knowing, say maybe they want to seek therapy, but they're for any number of reasons don't want their parents to know, how can they go about that? Maybe say, is there, are they able to call the number? What do they need to be able to call in? Do they just need their member ID? What are your thoughts about that, Shelly?
Yeah, so thank you for asking that question. And Jessica, great. Yeah, honestly, great question to bring up, because I mean, I think about when I was a teenager and I'm like, I didn't want my parents knowing about half the things that were going on in my life. I wanted to be private. I wanted to do things on my own. And so I totally get why that question comes up. And through CalOptima Health, kids, I'm going to call them kids, youth ages 12 can actually call the behavioral health line and say, hey, I would like behavioral health services. I would like to receive therapy. And that's the magic number 12. 12 is the age where they can call in and request those services without parent consent, without their parents knowing. I do want to mention the medication piece again. If for some reason they are prescribed medication, and if they're 12, 13, 14, then it gets a little bit more complicated, because once medication comes into play, then parent consent is needed. So you have to kind of think about both those things. But if medication is not prescribed and they're just seeking a therapist and the therapist says, hey, no medication is needed, then they can receive those services without parent consent. And again, the magic number is 12.
That's great. I appreciate it, Shelly. And maybe a little bit of additional piece that just kind of a point of reflection is that this might be for those of us who are working with young adults, kind of a point of advocacy for them in terms of, and we'll get to the more broad question along these lines in just a bit here, but inevitably there's going to be, in this transitional period, right? There's not only is there going to school, there's all these other new things happening, but one of those things is just learning. I mean, to use the phrase, right, the adulting, right, learning things that you don't even know you need to know them until you need to know them, right? And so one of those things can be like, hey, if you're 18 or older, maybe even if you're a teenager for that matter, you should have your member card ID if you have health insurance. The other thing to consider is that I don't know if this is true for CalOptima, depending on your health insurance, you may have a digital card. If you have access to that health insurance provider, that health plan's app, sometimes they'll have a digital version of the card with your member ID available in the app. So you can utilize that at times to access services. But yeah, thank you, Shelly, for your response. And then I want to open both questions, both the question of how can we better support youth and young adults in their accessing mental health care through health insurance, as well as if you have a particular thought about Jessica's question, up to everybody else, Portialyn, Kailey, Alexandra, if you have any thoughts.
Yeah, David, I did want to make mention about your last point about, the youth kind of accessing that insurance information or that member information. And Kailey's overview of how the front office, works with insurance, she mentioned the guides. So we created these guides because of this. Because oftentimes students, upon enrollment, after they've been accepted, they fill out their paperwork. They now know, great, I have insurance.
Mm-hmm.
So they know they have it. Right. They know their name. They can tell you their date of birth. They can give you those basics. But when it comes to say, okay, what is your, insurance ID? I'm like, I don't know. Where do I find that? So we learned very early, and I didn't attend to UC. I'm a transplant here to California, but very quickly I had to learn myself of like where to direct the student to find this. So you mentioned the digital version. So download the app. Do you have the app? And then like where to go in the app. As Kailey mentioned, Kailey attended a UC as well, not UCI, but, you know, had some familiarity, you know, with services. So that was very helpful for how we were able to kind of create content for students, kind of with that student perspective as a student within the UC system, but had to really kind of pull together materials to really walk students through on what to do. And, you know, Alexandra made a good point as well, that with the students, when they're reaching out to the UCs, if they do have that insurance, you know, they are referred out. And so a lot of how Acacia, now Mindpath College Health, how we're designed, all of our front office coordinators and team leads, a big kind of part of their job, it's not quite written in the job description, is help students navigate and understand their benefits. I think Kailey has probably learned more even about commercial insurance than she ever cared to or ever thought that she would need to, but just because not every student has UC SHIP. And so that makes it a little bit tricky because the different insurances have carve outs, you know, for the mental health benefits. And that's a whole different beast. Or if they have primary versus secondary insurance and they're like, I don't know which one I'm supposed to use, or they only give us one insurance, it gets denied, they get a bill, they're freaking out, like, how do I pay for this? And we're like, okay, slow down, hold on. And so then our teams kind of become, you know, little investigative reporters or detectives, you know, kind of helping students navigate through, saying, here's who you should call. Here are the questions that you need to ask. And so a lot of our front office team leads, and that's the role that Kailey's in, it's kind of the most senior person in for our front office teams. They have done three-way calls with a client and an insurance provider to kind of help ask those questions or be that person, or have had numerous ROIs filled out so that the client can kind of be there to, you know, give the, you know, approval, and we can help them ask some of those questions and get those answers. And Kailey, this is your cup of tea. You're well more versed in this. So I'll kind of pass that on to you if you have anything else to add based on that.
Oh, yeah, I think that was a good overview to that. Trying to think if we do any other examples I could give. But yeah, typically we just ask for all of clients' insurance, and kind of to Portialyn's point of the students or clients not really sure what their member ID and things like that are. We typically just get a picture of the front and back of their insurance card, so we can kind of see what their insurance card says, like what the numbers are, and then you know, the number on the back of the card, what that is, and things like that. But yeah, we do a lot of liaison work with insurance, and you know, letting them know, please call the member services number on the back of your card. You need to ask them this. You know, you need to ask them which one is your primary and secondary, and the insurance, and they can help you figure that out. So yeah, it's a lot of like coaching kind of process, and educating them about insurance. And like I mentioned before, we have a client-facing biller who will take client calls with any questions they have. So that's been a really huge help as well. Because as Portialyn was saying, she can kind of investigate to see kind of what happened with the claims and how they processed. So that's been really nice as well. So the client has someone directly to go to and speak with billing and know that we are, you know, working on any issues that arise. But yeah, for the most part, we just kind of work with clients where they're at and try to help them get those insurance issues solved.
That's great. I love the idea of creating a guide, right? It both cuts down on the work in some respects for you all. I mean, eventually, if you had to do this enough times, you figure, let's streamline things, which is really kind of a big part of this question, is how can we effectively streamline things for youth and young adults who are accessing health insurance or attempting to use health insurance to access mental health care services, right? I also wanted to highlight something that Shelly mentioned, the existence of organizations like CHIOC who can help folks access or apply for Medi-Cal, right? And she also mentioned FACT, and so FACT is for those who are not sure, is the umbrella organization, or is the organization coordinating the efforts between the various family resource centers here in Orange County, sometimes called FRCs, which, like as she mentioned, are dotted throughout the county, especially central and north. that help with a variety of issues that families may be experiencing. One of those being how to access health insurance so that they can and utilize that health insurance to access mental health services, or particularly Medi-Cal. So Alexandra, I also wanted to give you an opportunity if there's anything that came up for you in this question about particularly someone who is working, who has, as a student, was accessing, utilizing your health insurance, as well as a student on the advisory committee for SHIP at UCI. What are your thoughts about how we can better help students utilize the resources that are available to them in this regard?
I think that's a great question, and I wish I had like a fully complete answer.
That's okay.
But I think the most important thing is when a student walks into college, they don't know fully what their insurance is. I had a little bit of a different experience. I had the same insurance growing up my entire life. My mom worked at that company, so I was very well versed in what my insurance was. And I actually kind of became the unofficial insurance rep for my dorm floor. And I was kind of the one who answered all of my friends how to do certain things. And that's, I think, really important is when you're going through that transitional time in your life, having information on what your insurance is, how you can get services, what it means would be really important. And I think if you're an insurance provider or anybody who's in that role in the mental health field, somehow providing information to young adults about how to use the services in just very plain English, not complex terms, like anybody could look at it and understand down to what a copay is. I mean, realistically, just the very baseline things. That would be really beneficial, I think, because it would allow students to feel more confident in their ability to access services. But truly and honestly, I think it's a deeper issue than just not knowing how to access it, but sometimes this is the only time they'll actually have coverage, especially if they enroll in the student health insurance after not really having coverage for their entire life. You don't know where everyone comes from. So I wish I had a better answer, but I do know that that's kind of the baseline.
That's great. That's fantastic. Yeah, I really value hearing about, I think maybe this kind of boils it down, that to the extent that we have knowledge, right, that we have information, that, you know, kind of stepping into that role and being willing to, you know, we've already talked about some official channels or some organizational channels where youth and young adults can get support. But what you were highlighting, Alexandra, like you were doing for your dorm floor, right, is just if we have some knowledge, being willing to share that, being willing to take the time and create space to be able to work with a young person who's just trying to figure this out. And if we have the ability to, we have a little bit more knowledge than they do, sharing that knowledge, we have some ideas about where to look, sharing that information, looking with them, right? Not just pointing in the direction, but walking with them through the process of trying to get access and all of that. This could be really crucial. And it can be so easy, I think, sometimes to talk about health insurance, and we do on a popular level, in the context of, oh, it's just so complicated. You're just better accessing services some other way, right? Or trying to access a service some other way. But the reality is, at least, you know, here in California, in Orange County, if I'm trying to see a licensed therapist, for example, I'm looking at $150, $175, $200 a session, right? That's a lot of money if I'm trying to go weekly, right? And so taking use of the health insurance that might be available to me, or accessing health insurance that really can help streamline that process and frankly make it more affordable and help me get the care I need, even if it is sometimes a little complex in terms of trying to access. So I really appreciate for you, Alexandra, just that personal experience and being willing to step in that role. Okay.
Yeah, David, I wanted to add to what Alexandra said as well, when she was kind of mentioning like about copays, like what is a copay, what is a deductible, what is coinsurance. You know, when students are oftentimes you know, trying to establish mental health services, it's not because they just had a lovely walk along the beach with their toes in the sand. You know, they're usually in crisis. You know, they usually maybe in their world had the worst thing happen, whether it's trauma, they're failing a course, their boyfriend broke up with them, their longtime pet passed, I mean, all of the things that we know that happens, and it's usually a devastating time in their lives. They're also away from home,
Yes.
and whatever home may look like. So not everyone, came from a home with, maybe two parents who had them on their insurance, but whatever that family of origin was, we have a lot of students who they're now kind of having to navigate and do this all on their own. And they can't ask mom or dad for help or a sibling for help or anyone else. And so I think that's where it is so important that we have an understanding. And if we don't have the answers, we at least are aware of who does have the answers so we can get them to the right folks. And so again, as I mentioned, for our team, that wasn't kind of becoming well-versed in insurance wasn't our intent, but very quickly, for the Irvine office, it was a newer office. We learned very quickly, like, okay, the students have a lot of questions. This is good. We need to have these answers, because when they've already gotten a live person on the phone as well, so they're speaking to an actual person, there's even more questions. And so we don't want to say, we can tell you A, B, and C, but D through whatever, we have to pass you along to someone else. Sometimes we have to. We have to do that. But as much as we can understand and provide to them, especially when they're in crisis, it just leads to a better outcome, for that student. And then kind of being able to, be aware of some of the resources that we're even discussing here, to help them get some additional answers and just to really meet that need.
Yeah, that's good. Portialyn, you bring up a really important point, that it's not like somebody finds himself in need mental health services and they're like in a space like, hey, yeah, I can wait for the time it's going to take me to fill out an application for health insurance and then make sure I get approved and then figure out how I access mental health services, then wait till the provider's available. And then, right, there's a lot of work that needs to be streamlined, right? Either because they're able to speak to someone who has a level of expertise and helping them navigate that process. It also comes to mind for me the value of maybe thinking about this in terms of prevention, right, or preparation, right, and here really promoting to students the importance of already having health insurance, and if you already have health insurance, having some sense of how you access mental health services through that health insurance for the day you might possibly need it. Which is why a lot of groups have done things like, I appreciate with CalOptima, my health insurance also does something similar. My health insurance plan, you have a number you can call, and that's how you access behavioral health services. You talk to a navigator who helps you figure out, what's happening for you, what level of care do you need, and how do you figure out, how do you narrow that down to actually getting in contact with a provider. Yeah.
David, if I could, I'd like to
Yeah, please.
also add on to a little bit of what the ladies were talking about. So yeah, when people need health insurance, they're usually seeking it because something has happened in their life, right? And I think that kind of goes back to why it's important to renew Medi-Cal. Most community members that have Medi-Cal, they're just like, yeah, whatever, like I'll renew later, or I'll reapply when I need my health insurance. But as we just heard, and as we're all aware, when people need access to their health insurance, it's because something is happening. And as I mentioned at the very beginning, the application for Medi-Cal in itself is such a lengthy process. It could literally take anywhere from 3 to 4 months. So it's a really long process. So if people renew on that yearly basis, then they have continuous coverage in their Medi-Cal. And so I want to also add on to that, because I received a question privately, and they were asking about the Medi-Cal renewals. Some of you might be aware that during the public health emergency during the COVID-19, the 3 years of COVID-19, Medi-Cal wasn't asking people to renew. So there was literally no renewals happening for 3 years. So that means that people lost practice, or people are, just not used to it anymore. But as of April 1st of this year, the Medi-Cal renewals started up again. So that means that when people receive their packet in the mail, they have to fill it out and send it back within 60 days. Otherwise, their Medi-Cal will be terminated. And again, for 3 years during the public health emergency, Medi-Cal was not being terminated because the renewals were not happening. No one was being asked to renew, but now that is happening. And again, that started happening as of April 1st. So people have already been receiving their packets in the mail. Some people, if they maybe gained access to Medi-Cal in November, they're going to receive the packet closer to November. But for the people that have maybe renewals happening this month or in June, July, they're already receiving their packets. And so we want to make sure that people understand and are aware that those renewals are super important. That way there is continuous coverage.
That's great. Yeah, thank you. And this is, an important thing about, the last couple of years, there was some changes. Now we're changing back. We're changing in another direction. And it's important for folks to be aware of. They need to renew, at least if they have Medi-Cal, renew every year so they can stay on top of services. And I think these are some of the pieces that we're talking about in terms of knowledge gaps that are important for us on an individual level, on an organizational level, on a systemic level, to help young adults navigate and think through, so that they're aware and they have health insurance and they have access to those services when they need them. I did want to quickly mention Alexandra had to hop off a bit early, but she wanted me to share something in the chat, so I'll post that in. But I want to thank her for joining us. Maybe one more question to kind of wrap us up, and then we'll go from there. I feel like there's never enough time in these conversations, but I am incredibly grateful for you all joining us and participating. So maybe the kind of last follow-up question, kind of along the lines of what we've been talking about, are there any other knowledge gaps that come to mind for you all that are common among young adults that it's important for us to be aware of if we're helping a young adult try to navigate this process? We talked about a few, but are there any others that come to mind?
I'd like to bring up transportation. And the reason why I bring it up is because a lot of our members or people that have Medi-Cal don't have access to a vehicle. They don't have access to transportation, or maybe they have one family car. And so transportation is actually a Medi-Cal benefit, and transportation can be requested. So let's say there is an individual that wants to go to their weekly therapy appointments. They can call in advance. We ask for 2 days in advance that they call and say, and let us know, hey, I need a ride to my appointment. And that way they have a ride to their therapy appointment and back. So it's round trip. And so that way they're actually getting to their appointments, because oftentimes transportation is a barrier. And so that is a Medi-Cal benefit. And a lot of people don't realize that that is. And so I'd like to bring that up because, I mean, I remember, growing up, we had one family car. And sometimes if my dad was at work, then we were like, well, we have to either take the bus, walk, or what are our options here? Not go. And so it's important for people to know that if they have Medi-Cal, they can utilize that transportation benefit to go to therapy appointments, to the pharmacy, and to doctor's appointments. So that is an option for our members.
That's great.
Yeah, Shelly, that's such a great point. Because for us, we're located near the university, so students can access our services, because oftentimes when the university was referring out to others, that was the number one barrier for students. They don't have cars, they may have a bike, but they can only ride so far. They're UCI, they're not hopping on the 405 on their bike. But that's also where you mentioned how during the pandemic, members didn't have to renew their Medi-Cal. So during the pandemic as well, a lot of insurances kind of followed CMS and expanded to allow for telehealth services. And now that the PHE is ending, some of those plans are no longer allowing telehealth as a covered benefit. So I bring that up because of the transportation piece, right? So during the pandemic, or since most places, not all, but a lot of places had gone completely telehealth, transportation was not as big of a concern. But now that the PHE has expired, it is again, because not everyone can continue with telehealth. It's not an automatic covered benefit. So for example, I mentioned that the UC ship is a carve out of Anthem. The plan that the students have for UCI does include telehealth. So that made things really seamless for students on March 17th, when the world kind of shut down. We were doing in-person services that Monday, but that Tuesday we had to go completely telehealth, and folks were scrambling, especially those who had commercial insurance that did not have that as a benefit. We were having, at that time, we were calling the insurances and almost begging, saying, this is a really critical time. Students can't travel back home. They're too young to get a rental car, because you had to be 25 to get a rental car to even drive home to mom or dad or wherever it was, like, what can we do here? And so things had expanded to telehealth. We know that we've seen in some areas where they've allowed for telehealth to continue, but in others they've gone back. And so that's made it really hard, especially even doing services across state lines. So we have a lot of students that aren't from California. So, they're from other countries, or they're from Arizona. It's a state over. And it becomes really tricky now that the pandemic allowances have expired, of being able to continue some of that care.
That's great. We'll finish with one more question in the chat. Steve asks, could you speak to youth awareness and usage of warm lines, CalHope, NAMI Warm Line 988, and referral lines, OC Links 211, OC Navigator, Unite Us, so on, to find health insurance? I'm not sure if you all are able to speak to that too much, but I think it's important to consider kind of one of those knowledge gaps. Much like Shelly, you mentioned the line that you all have, CalOptima, that folks can call to access and navigate behavioral services. Portialyn and Kailey, I know the folks who have access to you all should give you a call, and you have those guides to help them navigate the process. But maybe another thing to consider is the value of these other warm lines and hotlines that are out there that folks can call to help begin the navigation process. I don't know if you all have any thoughts or comments on that.
Yeah, go ahead, Shelly.
Oh, no, I was just going to say, I'll be quick. I was just going to say, I think they're great that they're available to the community, because as we learned today, sometimes people don't know what health insurance they have, or they don't know what to do or how to go about it. So this is always like a good first step. Or if they're in crisis, they can also call these different lines. So I think that it's great that they're available, because to my understanding, they're 24 hours. So people can call after hours, and then they get pointed maybe in the right direction.
Yeah, just to add to what Shelly shared, they're very crucial to the work that we do. All of our offices, our main office's email address has the warm lines or links. Some of them offer chat functions as well. It's in our email signature. So anytime we're emailing with a student, some of these pop up in the email address, because we're open, Monday through Friday, roughly 8 to 6. So if a student is, reaching out Friday night at 11, or, Sunday morning at 10 a.m., they're not going to get a live person, right? Even though they have a therapist they see every week. So it's very crucial for us that we are knowledgeable and have access to these warm lines, and we make our clients aware of them. So even a lot of our providers, they will create a safety plan for students who are a little bit higher risk. And a lot of these are right there on the safety plan as well. During sessions, they'll have clients pull out their cell phones and even save them in their phone so that they have access to them, especially that chat one, because sometimes having that, I hate to call it a distraction, but just having that interaction with someone who is going to chat you right back or text you right back, but you're not having to really be on the phone, makes all of the difference as well, and can be that nice holdover until Monday morning when they're able, to access their provider. So very great call out.
Great. Great. And I also want to mention too that for those of you visit connect-oc.org, you'll find those numbers, one of those hotlines and warm lines on our website. And we also have put together a wallet-sized card, like about the size of a business card, that has some of those numbers on it. So if anybody would like something physical that they can maybe hand out to people they're working with, to friends, family, students, clients, whatever it might be, please reach out to us and let us know, and we can see about helping you get a hold of that. Great. Well, it's about time to wrap up. I appreciate Portialyn, Kailey, Shelly, shout out Alexandra as well. Thank you all for joining us. I think this was a good conversation. If nothing else, I'm hopeful that it has put this question on our radar a bit more so that we can continue to try and learn a bit more and help students see the access points that they have through health insurance as an important avenue to seek out services, and also to begin doing some of that work now from the perspective of prevention and preparation, especially in line with, as you mentioned, Portialyn. So thank you all again. We're going to shift now over to some updates from the coalition, and then we'll open up to updates from you all. Please take a moment to complete our survey. Crystal just put it in the chat. As you all may know, if you visit us regularly, that the survey is important to help us think about how we can continue to improve the coalition meetings. If there's other topics you want to cover in the future, whether or not this was helpful for you, how we could make it more helpful, that is all important feedback for us. So we'd love it if you could take just a couple minutes to fill that out. So I'll hand it over to Sarah for any updates we have for the coalition.
Thanks, David. And thank you to all our panelists that were able to speak and help inform all of us on insurance and the complicatedness that it is. I personally learned a lot. I was very confused walking into this of like, what the heck does insurance entail? How can you get access to those services? So this was super helpful for me, at least. Just a couple updates on our end. We're coming off a really busy month, as I'm sure all of you are as well, from Mental Health Month. But we recently had an Instagram Live. It's called Real Talk. It's like a new series that we're kind of coming up with, just giving young adults a spotlight and a space to share their mental health journey, and to hopefully encourage others to share their stories with their friends, their loved ones as well, in order to break the stigma around mental health and kind of normalizing conversation. Our first episode is on our Instagram. It was with Camila. She is our intern, our health education intern. And it was amazing. And it was just so exciting. And we need more young adults and students to participate in this. So if you have like a student in mind or a young adult that would love to share their mental health journey, please have them reach out to me. I'll pop my email in the chat right now, and just we can get connected through there, and we can maybe schedule like a meeting or get them going on the next episode of the series that we're going to be doing also. So there's that. And then we are actually planning a couple resource fairs for next year, next school year, with Vanguard and Cypress College. And we are looking for resource tabling and vendors for that. So if you are interested in getting involved with like the mental health resource fair piece of both of those schools, or if you have connections or something like that, please feel free to reach out to me as well, or Crystal or David. Anyone really. We would love to keep you in mind and have you in our back pocket for when the time comes of us planning officially and kind of narrowing down the resources that we want to have at these events as well. So that's basically what's coming up for us. And if you have partner updates, we'd love to hear from you. Just go ahead and either do the little raise your hand icon, or I can just call on you if you are ready. So we can start with Matthew.
Hey everyone, it's good to see you guys. My name is Matthew Chavez. I'm from the Noruz Clinic Foundation. We're a nonprofit mental health clinic in Santa Ana. And we actually have a free one-day mental health resource fair coming up on Saturday, June 3rd. So it is about, it's about almost a week from now. We will have around over, I think I looked at the official head count, we'll have like 40 vendors attending the fair. And so this event is also in collaboration with the Orange County Healthcare Agency as well as the Iranian Chamber of Commerce, but it'll be a free one-day mental health resource fair. It'll be from 12 to 5 in our office. I do have my colleague here, Michelle. She'll post some flyers for the fair to RSVP or just, check some of the stuff that we have at the fair. There will be massage therapists there, yoga instructors. We did manage to get an animal shelter to come out, so they're bringing their puppies and you can, pet them and even adopt them on the spot if you'd like. So yeah, it'll be great. So if you want to kick off the summer with a free event and you don't have to pay for anything, definitely come out to ours. So hope to see you guys there. Thank you.
Thanks, Matthew. That sounds like a really, really fun event. Honestly, that's so cool. Yeah, Kat, go ahead.
Hi, everyone. Good morning. Are you all able to hear me? All right, perfect. So I'm Kat Reyes. I'm the Community Education Coordinator for Planned Parenthood of Orange and San Bernardino counties. And I just wanted to update everyone with our new puberty workshop. We just launched a new program called Here Comes Puberty, where it is a free interactive 90-minute session where parents, caregivers, and their youth can come together to learn about puberty and how to navigate those conversations to just build that bridge of communication and support. This is available to anyone who's interested in who has either a PTA group, a parent group, or a group of parents. Whoever is interested is able to book a workshop. Doesn't matter the time, we can do it on a weekend even. We just have facilitated a couple of workshops to Girl Scout troops, and it went pretty well. And lastly, we have the Peer Ambassador Program. Applications for the year-long program have opened. They will be closing at the end of July, and this program provides year-long activities and opportunities for high school aged youth to not only learn about reproductive health, but also become a resource for the community. And I'll go ahead and add those flyers to the chat. Thank you so much, everyone.
Yeah. Yes, please do. Thank you. Go ahead, Cesar.
Hi, good morning, everybody. Cesar Hernandez from the LGBTQ Center. I am the youth program assistant, and we've got quite a few upcoming events since we have Pride is in June. So I will be posting those in the chat, but we have a lavender graduation. So if you know of any youth or young adults that are graduating from either middle school, high school, or college, we would love to celebrate them. We have a photography gallery showing at the beginning of June, and then we have an art gallery showing at the end of June. We've got a queer prom event coming up at the end of July. So if there are any youth that would like to participate in a queer prom event, it's a free event that we'll be having at the end of July. And then I will also be posting a link to our Elevate mental health counseling services. We do offer free mental health counseling for youth and young adults ages 12 to 26. It is free and do not need parents' permission. I will post it in the chat. And yeah, that's all I have from the LGBTQ Center. Thank you.
Thanks, Cesar. And Tracy.
Hi, everyone. Thanks for having me. My name is Tracy Nguyen. I'm a Community Relations Specialist at CalOptima Health. Thank you for having my colleague Shelly be a panelist today. And I just wanted to share some of our upcoming events. So we also on June 10th, we are having a CalFresh enrollment event with Social Services Agency. It's going to be hosted at St. Anthony Claret Church from 9 a.m. to 1 p.m. So I just wanted to share with everyone. Thank you.
Thanks, Tracy. Anyone else before we hop off? No? Oh, David, do you have something to say?
I was just gonna say thank you everyone for joining. If we're all set, we'll do the gift of time. It's 12 minutes.
Oh, yeah.
Yeah, go nuts.
Have a happy Friday, everyone, and a great Memorial Day weekend. Get some rest. Won't be very warm, but it'll be nice still to just have the day off. So have a good one, everyone. Thank you.
Take care, everyone.
Thank
Bye,
you.
thank
Have a great
you.
weekend.
Thank you so much.